We had made a commitment to both her mom and dad that as long as we were physically able, we would take care of them. Not having the experience in the healthcare profession, that's kind of a daring thing to say because we really did not have a clue. There were things we knew we should do. We did not know they were the right things.
Lucille had faith. She had faith in Girl Scouts, courageous and strong, friendly and caring, sister to every Girl Scout. The thing I would say most is that she cared about everybody.
She spent 70 years in scouting. She was a Girl Scout when she was young, and then when she was about 16, she became an assistant leader. When I became eligible for Brownie age, then she started again, and I stopped and she didn't.
She has a special place in my heart. I was a Girl Scout leader as well. I was a Girl Scout when I was younger. I remember a phrase from Girl Scouts, "Our hearts can be silver and our hearts can be gold," and she had a most golden heart.
Lucille was very big in community service. She loved to have the girls out in the community doing things so people could see us and see what we did. We don't just sell cookies. She wanted them to know we do other things. We watered the flowers in town. We were ushers at the theater. She had us out and about all the time. Scottsdale was lucky to have her.
I found it amazing that she gave of herself so many years, doing so many things for the Girl Scout organization, and she will always have that special place because once a Girl Scout, always a Girl Scout. It's been over about 2.5 years that we've been seeing Lucille. And when she came back to Frick, her daughter made the determination, because Lucille told her she was done, she was tired. She made the decision to put her on hospice, and we brought her home.
My mom could be feisty, in a good way.
And Missy was feisty back, in a good way.
So whenever I go into a home, I explain to them why I'm there. I am here to provide you the best possible care I can. I am the resource that they can use to get whatever they need, whenever they need it, and never to fear calling me 24/7, because there's always somebody available.
She made sure we understood, and any questions that we might have, she took care of to make sure. She took all the time necessary so that we were at ease with what was going on.
The continuity of care is also for her family. Her daughter, Martha, and her son-in-law, George. They needed that support that we could provide to them. And the support that we provided to them was making sure that they had the same nurse. They knew who the nurse was coming, and they had the same aides and other caregivers in order to provide the best possible care for Lucille. When we have that continuity of care, it builds trust. And trust is so important in that stage of the transition.
It basically allowed us to see that we were doing the right things, we were given the proper guidance. And when they were there, they were supportive to us, helping us to relive the good times, to understand these things.
From personal experience, families see it from the perspective that the nurses and staff coming in are part of their family.
She was a godsend.
And I felt honored to be able to go in and provide her everything that I could to give back to her. It's time for her to have someone give back to her. She's given to us so many years that we needed to take the reign and say, Lucille, you just sit back, you relax, we got this.
I went from being the daughter, and then as her disease progressed, She didn't know I was her daughter. Some days I was one of her sisters, one of her many sisters. Sometimes I was her mother, sometimes I was that nice lady. But that's okay because I knew she loved me, whoever I was.
But to describe your relationship between you and your mother? Amazing.